Hello, and welcome to Community Nurse Home Care presentation on dementia-friendly at work in the age of social distancing. This is part 3, and today we're going to be talking about communication. My name is Carol McAfee. I am an LPN, a certified dementia practitioner, and a certified Alzheimer's disease and dementia care curriculum trainer. Community Nurse Home Care has been around since 1916, so we're pretty well established. We are an independent and not-for-profit home care agency. Our mission is to provide compassionate, personalized health care. We are trusted by the community, and our goal is to empower people in their home to better health. We have a wide service area from the bridges of Bourne out to Swansea, the far outreaches of Taunton, Middleborough, Carver, out to the outreaches of Dartmouth and Westport. So whether you or a loved one are returning from the hospital, recovering from an illness, or you just need some assistance at home, Community Nurse can help with your recovery. Communication. Communication is about what we say, how we say it, and how it is received. So how to communicate? We have to know how to communicate to our loved ones and those affected with dementia. First of all, let's check the tone of our voice. The tone of the voice we use, our body language, becomes more important as the person with dementia loses their ability to understand the spoken language. It's important that we use a calm voice and try not to speak too loudly. Speak in the volume that they can understand you in a quiet environment so that you can focus and they can hear you easily. Smile and use gentle humor. This can help the person feel more comfortable. And watch your own body language. How are you standing? Are your arms and hands folded? Are your arms folded across your body that says, I've got to get this done and get out of here? Does your posture convey, I want to help, or that I'm frustrated? Are your hands on your hips saying, come on, let's get this done? So knowing how to communicate, we need to approach the person from the front. The person with dementia may have lost their peripheral vision and working towards tunnel vision or binocular vision. Approaching from the front may reduce fear and prevent them from being startled. It's important that you not startle someone because you do not want that negative connection to be established. If you've got a negative connection, you're not going to get the task accomplished when working with someone with dementia. Speak clearly and be patient. Speak clearly and calmly and allow the person time to understand the information. It may take a little bit longer for them to process, but help them to hear the information. They may have trouble hearing. They need time to interpret what you're saying. You may try to use different words if they're not responding. Use short sentences, avoid direct questions, and keep choices to a minimum. Don't raise your voice. Find a quiet, non-distracting place to talk. Avoid a place that has dogs barking. The TV is on, the radio's too loud, and by all means, shut off the news. Listen closely to what they're trying to say. Give them encouragement as you look for clues about what they may be trying to communicate. They may seem confused about something that just doesn't make sense to you. Look for a word or suggest a word. Suggest one and try to be careful not to interrupt them and finish their sentences. Be careful not to rush them, because the more you rush them, the more upset they're going to be, the more it leads to confusion, the less time and the less success you're going to have trying to accomplish your task. Smile and make eye contact. Now, in this age of social distancing, when we're all wearing face masks. You cannot see the emotion. You can't see the facial expression. You might see lately people using clear masks. These masks allow you and the person you're working with to have the protection as a face mask, but they are able to see your facial expression. They're able to see that smile. They're able to see that giggle. We're all trying to struggle with these face masks because it muffles what we're saying. But if you are using a clear face mask, the person will be able to get your message. Be careful of your body language, that it's not being frustrated, that it's not saying, I don't have time for you today. Use that friendly tone and give the body cues that are respectful of personal space. Now, in this day and age, we're all told about respecting the personal space, the 6-foot distancing. Folks, us huggers are not in a good place right now. And the folks who don't understand the social distancing just quite yet, you need to reinforce it, especially in this age of social distancing. So use that smile, use humor, gentle humor. Respond to a look of distress. Now, at times, people with dementia, they may have forgotten where they live. If someone looks lost or distressed, offer by asking them their address. They may not be able to give it to you, but ask them for something in the bag or pocketbook that might have an address on it. In the age of social distancing, this is even more important. You may need to contact your local police for help. Working with folks in the home, there's a number of things, safety issues now that are available to you. For folks with dementia, your caregivers, your loved ones, they may have security cameras in the home that you can put an app on the phone to make sure that they are safe. There's inner soles for shoes with GPS in them. Hearing aids. I wear 2 hearing aids. My hearing aids have GPS in them that can tell me where they are if I've lost them or can't find them. But what will it do? If I wander off and get lost, the app on the phone is going to tell my family where they are. You can also put a black mat in front of the door. Not 100% effective, but for those folks who are possibly wandering outside the home, it can be effective. Don't be afraid to call your local police for help when there is a look of distress. Watch for signs of change and offer to help accordingly. Every day might be different. For some folks with dementia, each day can bring a change as to what they do. Every day it's like the window shade going up, but today is a good day and we've had several good days in a row. And you're wondering, oh, does my loved one really have dementia? And the next day, the window shade is down and it's dark and they're more confused. Every day will be different. Your journey with your loved one with dementia is not going to be the same as your neighbor's loved one with dementia. Everyone has a different pathway, different walk, different journey. So know how to communicate. What's working for you to communicate with the person in the community today might not be how you communicate with them tomorrow. People with dementia, particularly at a younger age, often find it meaningful to help with community activities. For such a person, it is important that tasks are clear, direct, and broken down into small steps. Now here in this day and age, the Alzheimer's, for folks who are younger than 65, it is often referred to as early onset dementia. For folks who have another type of dementia, such as your frontal temporal lobe dementia, those folks tend to be between the age of 45 to 65 when that's diagnosed. But what you want to do is someone who is particularly younger, you want to help them have a purpose. Everybody in life needs to have a purpose. So you may have to break things down step by step. Directions can be a bit confusing, especially for someone with Alzheimer's. Break that step down, break that task down into step by step, so it's not frustrating to the person. Offer to have him or her start over again. Break that task down, smaller steps. Make sure you are in a quiet environment and not too distracting. Make sure the dog's not barking. Make sure the people are not coming in and out and the TV is off. Put on some soft music if you want something on. Demonstrate the task and give verbal directions. Now, folks with dementia many times don't even have a 30-second recall. So you may have to repeat these steps slowly and over again. Observe them that the tasks are not too difficult for them and help them so that they are not taking longer, or have them just do one part of the task at a time. And follow up with any volunteers. Help them understand and let them know how they can help in the future. So here in the age of COVID-19, tips for our caregivers. First of all, please understand, dementia does not increase the risk of COVID-19. What increases the risk is the behaviors. These folks are going to need step-by-step directions to wash the hands. Washing your hands for 20 seconds, scrubbing, you may need to do it with them, but sing happy birthday 2 times in a row. Hey, every day, everybody can have a happy birthday every day, right? Several times a day. But that will help you with your hand washing. The caregivers should follow the current guidelines of the CDC, and we should all be careful to check those guidelines frequently as we know that they are changing. People living with dementia may need extra or written or pictorial reminders and support to remind them about these hygiene practices one day to the next. Now, I encourage everyone, use pictures. It is very common, I'm sure it's happened to you. I get out of the car, I'm going to go into Cumberland's and get my iced coffee. But what I get to the door and what stops me is the sign that says, wear your mask. But it's not a sign, it's a picture. It's a picture of a face mask, and immediately it checks me. So I go to my car and I get my face mask. Avoid something that says, no mask, no service. Because what you have done is already you are giving a negative connotation. Also, the pictures are more easily identified as if rather than someone who is having difficulty reading. People living with dementia need that extra picture. And remember to practice it in the home too. Practice it in the home if someone is having difficulty remembering where the toilet is. A picture of a toilet on the door or the wall beside the door might be helpful for you. You might want to put a hand washing sign up by the sink. Ask the pharmacist or the doctor about filling a 90-day prescription instead of a 30-day prescription. It may be cheaper, but it will reduce the trips out of the home. And next, have a plan. Please, folks, if you have a loved one with dementia, make a plan. If you are a business, make a plan. Have an alternative health care plan if the caregiver should become sick, have an accident, or in addition may be available for care. Look for someone who can help you. Have a family meeting so that you have that second person to call on. activities for brain stimulation. In this age of social distancing, many of our adult day programs, social day programs have closed down. Some of them are open for limited hours. Some of them are open for limited population. But it is important that everyone has a purpose. So you folks at home, make sure you are doing things like taking your loved one outside for a walk in an uncrowded area if it's safe. A wheelchair may be necessary. Exercise. Now, exercise is very good for the brain, not only the body, but good for the brain because it keeps the blood flowing. Sing-alongs. How many of you are afraid to sing with your family? When I walk in with a patient, you can ask them. I often will sing with them. I can't carry a tune in a bucket, but what am I doing? I am connecting with them. I am bringing some humor. I'm bringing a smile. We all know the Star-Spangled Banner. Can't think of the words? Sing a nursery rhyme. Your folks with dementia are going to sing along with you. Music memory is very, very important for brain stimulation. And I want to encourage you too, for you folks who are working with a loved one at home, the music memory between their ages of 18 to 24. Now let me ask you, what were you doing between your age of 18 to 24? May have been getting married, maybe setting up a career, buying a house, having babies. The music that you heard between the ages of 18 to 24, that music memory has a way of sticking with us for a lifetime. Those memories, when that music is played, it lifts our spirits. I am a child of the 70s. I love 70s music. And to this day, I still play it to lift my spirits. Have a basket of towels to fold or socks to match. Who cares if the folds aren't done correctly? Who cares if the socks don't match? Everyone needs to help to get something done. It is giving your loved one a purpose. So keep that basket of towels available for your loved one to fold. A basket of socks for your loved one to match. If it's not done right, it's okay. Have a spa treatment with soothing lotion, cucumber mask, manicures. It's really good to have a nice treat with your loved one. Games like bingo, Old Maid, I Spy with My One Little Eye, all can be stimulating for the brain. Reminisce. Review their life story. Everyone likes to talk about their life. What was your life like? How did you grow up? Ask them things like, who was your first date? Who was your first kiss? Did you go to the prom? Don't know what to say to somebody? Look around the house for a picture. I entered a wonderful conversation with a woman who I was just going into her house for the first time, and she was a bit skittish. But I spotted a picture of a young girl in a cowgirl outfit riding a horse. So I asked her, I said, that cute little girl riding the horse, is that you? Well, she smiled, and that opened up a whole new conversation, and I was able to connect with her. Stay on routine. Maintain that calm environment. So if your loved one gets up in the morning and goes right and has breakfast, gets dressed after breakfast, and starts about their day, you change that routine, it might upset their day. Stay on routine. And some folks are so intense with their routine that if they're used to putting on the left shoe in the morning and suddenly the right shoe goes on first, it is enough with some people to disrupt their day. So know your loved one's routine. Maintain that calm environment. Is the dog barking? Is the kids running through the room? Is there too much noise outside? And is the news on TV? Getting stuck in the news can lead to depression, and it can be a vicious cycle. Avoid the news, folks. Put on Andy Griffith, put on Happy Days, but avoid the news. So our overview of dementia-friendly at work. Would you like some dementia-friendly training in your work? You can contact the Memory Loss Program at communitynurse.com. Our training is free. What else can you do? Know the 10 signs. Know the resources available in your community. Share any occurrences with your colleagues so that everyone can be on the alert to helping this person. Let family members know in a non-judgmental way what has occurred. And if the person lives alone, share information with community professionals who can help you. So thank you for being with us today. We've enjoyed having you. This concludes our portion on dementia-friendly at work in the age of social distancing. We'd love to have you join us once a month for half-hour Zoom sessions for any questions and answers regarding dementia. I'd be happy to answer your questions. If you would like to join us, please submit your request to mlp@communitynurse.com. If you would like more information on dementia, please join me once a month for half-hour Zoom session where we will do a question and answer period. If you would like to contact me for further information, go to our website at communitynurse.com, or you can contact me directly at mlp@communitynurse.com. Thank you.